Hey everybody, it's Dr. Wellwood here, the Spokane area chiropractor. We have a patient here who's got generalized lower back pain. So she got lower back pain that kind of wraps around on the back. Yes. You want to tell them about it a little bit?
Yes, it wraps around. It starts in the middle of my back, and feels like it's inflamed, and then eventually it'll move down to my lower back, and then come around to my hip joints here with a burning sensation.
So from the lower back on, kind of wraps around. So initially when she was talking, I was asking her if she's like a bicyclist or a hiker. She's like, yeah, no, not happening. But that's actually a very common presentation for that. That would be like a hip pointer type of issue. But she's got some, she doesn't have any numbness or tingling down the leg. So what we're going to do is we're going to do an examination on her lower back. I'm going to do it again because we've already done it. So I've already figured out what it is. But I'm going to go through it with you guys. Kind of show what it is, because it is kind of an unusual presentation for a common condition. So go ahead and lay on the left-hand side for me, face that way. So what we've got basically is, I was joking with her about this before. I said, well, I found the problem. I found a pen in your back. Obviously, that's not it. But when chiropractors are looking at lower back issues, we're looking at both function and form. So we're checking out joints, we're checking muscles, bones, tissues, nerves. We know that she doesn't have a slipped disc in there. She doesn't have any numbness or tingling down the leg. She's got no issues with bowel or bladder problems, which are always concerned for us. And although she might have some tissue tenderness here, her pain is actually recreated when we provoke or push on really hard. Not even that hard, but basically to where your fingernail goes blanch, so it goes white. And we push on those areas there, and if it recreates her presenting complaint, then that's usually what it is. So when we were checking her out initially, we're going to check a couple different areas here. Right here? Mm-hmm. So I'm going to be basically pushing on a whole bunch of areas that there's a group of nerves that come out here. How about here? Mm-hmm. Yeah, so you can see how she winced right there. You notice I'm not grinding in there. I'm not actually pushing really hard. I'm just finding the area and provoking that nerve. How about here? Yep. So how about down here? Yeah. Yep. So again, you can see I'm not really pushing hard, but as long as you're pushing in the right spot, she's already like wincing. She's like pushing away from me. That must be pretty tender. Yeah. So that's those groups right here. And then we're going to look in her lower back down here as well. We're going to do the similar sensations. Any pain here? No. So now we know that's not actually coming from one of the branches. How about here? Feels it there. So, and how about here? Yeah. There. So we're actually not on the bone itself. We're actually right on the hip area here. So the bone ends up right here, and muscle and fascial and tissue end up right here. So if we kind of travel along, you can actually see she's wincing right here as well, right? Yes. So these areas are actually of a nerve called the cluneal nerves. It's kind of like George Clooney, but it's spelled completely wrong, or different anyway. And what ends up happening is that it becomes inflamed when people sit for prolonged periods of times, like truck drivers or people who are doing desk jobs. Are you sitting down a lot?
I do sit down, but I am not moving a lot.
So you're getting up and down all day? So there you go. She's getting up and down all day. And what happens is that the pelvis itself moves too much, and it puts a lot of inflammation around those nerves. And that can create this lower generalized back pain. Now, this diagnosis would be a polyneuropathy, so two different types of nerves, of the cluneal nerve. So it would be a cluneal nerve mononeuropathy or polyneuropathy. So if your chiropractor has been adjusting your lower back itself and hasn't talked to you about this, then ask them about that. Also, physical therapists tend to miss this as well. We had talked a little bit about the types of treatment. Yes. And we were talking about acupuncture for reducing inflammation, right? Mm-hmm. And some massage for potential reducing some of the tissue. And then chiropractic itself actually helps about 80% of the time here. It's not a cure, If the person has repetition, so if you're doing the same thing over and over again, you're not going to get 100%. right? But by manipulating those tissues and the around there, we can actually have a significant relief on some of the pain and pressure. One of the most beneficial treatments that we do is not as a chiropractor, but as at the Regenerative Medicine Institute, is a technique called perineural injections. So we actually inject along that nerve and we reduce the inflammation. It's without a steroid, so we're not going to have any tissue degradation. So the tissue is not going to eat itself away as it does with a steroid. And that's very, very close to 90-95% cure rate for that. Although there are, it is patient dependent, so it would depend on the person and the case. So right now we're going to go ahead and adjust that hip right there, if that's okay with you.
Yes.
Good. She's like, I want it fixed.
Yes,
so
please.
it's going to be pretty easy.
Okay.
Just stay right there.
Okay.
So in order to help with this, I'm going to move this a little bit.
Oh, yeah.
I'll put it in my
take
pocket.
that, yeah.
If I steal it, you know where it went
That's
from.
okay.
We're going to basically, we want to open up this nerve through here. You might hear a loud pop. We don't really care about the pops for this. We just want it to move, okay? We're all about function here and short-term treatment. So the faster that we can get somebody going with the least amount of time, that's the best treatment as far as we're concerned. Would you agree?
Mm-hmm.
Yeah.
Yes, I would.
Good. So we're basically going to open up and separate these tissues in here to allow that nerve to move back and forth. And we're going to do that with what's called a diversified adjustment. So I'm going to basically hold her up here, stabilizing her joint, and I'm going to roll it forward, and we're going to open up this disc space here. There you go. You okay?
Yeah.
That wasn't so bad.
No.
Got a couple out of it, but I think we're okay.
Yeah, we're fine.
So I'm going to go ahead and check it again. Any tenderness here?
Not too bad.
Good. How about here now?
No.
You can see how much I'm actually putting pressure on it. How about here now?
No, it's better.
Does it feel better now?
Mhm.
Ha, look at that. So we've already had a good positive approach. So there you go. Nice, simple, easy treatment for polyneuropathy, cluneal nerve. Not bad.